Broadcasting from the business capital of the world, this is the Podcast Business News Network. Welcome back to the show. We are excited to have our friend joining us again, and we have to welcome her back from Nashville, Tennessee, where she opened up her latest location. So excited that she's back with us again. Waybridgeclinics.com. That's WAYBRIDGE clinics.com. We're talking about ketamine therapy, and as a doctor, Leslie knows best. So first and foremost, welcome back today. How is everything going?
Oh, it's wonderful. So good to see you again, Jill.
You too. So tell me a little bit about the trip to Nashville. You just had your opening. Was that last week?
I was touring the clinic. We're going to be opening in about January, but it was just kind of going through and evaluating the space and how we're going to utilize it, because it is getting renovated right now because we want it
Okay.
to be nice and clean
Mm.
and to our standards. So that is happening as we speak.
Wow. And currently you're in Omaha, Nebraska, right?
Yes, I am.
All right.
Yeah.
Tell us a little bit about yourself, the work you do, and then we'll go into our detailed topics of the day.
Oh, sure. So my background is an emergency medicine physician, and I first used ketamine when I was active duty Navy, both on the battlefield in Afghanistan, but also in the emergency room as a pain modality. So in addition to usually people come to the ER for pain control, and we have to give opiates, but ketamine is another amazing option that is not nearly as addictive. And now we're finding it works for depression, which is why I opened my clinic because when you look at the data, it is so much better than what's been available with pills or other treatments in the past. So it's really exciting what we're doing with the ketamine now.
Uh-huh. And for those that may not know, it's one of the wonder drugs out there helping so many with certain things like.
Oh, so we primarily see it for depression, suicidality. It's the only medicine out there that will drop suicidality within hours. Chronic pain, PTSD, and then all this new research in things like TBIs, concussions, Parkinson's, and just the research just keeps going on and on and on because, as you said, it's kind of the new wonder drug. So the possibilities are endless because of the neuroplastic benefits.
And you've been doing this for quite some time. And as a doctor, clearly have seen the benefits of your patients and the clients that you're working with. So you mentioned again, anxiety, depression, also PTSD, right? Because I know that's what
Yes.
you worked with, a lot of chronic pain, obsessive compulsive disorder, and just really helping people get back to the way they were. And, for people out there wondering, how does it work? How many sessions do I need? Give us a little overview because it's probably different for everyone. But first and foremost, you got to see your medical doctor, right? You have to have a clearance, I'm assuming.
Yes, yes.
Perfect.
Yeah, we would like to have make sure that any medical issues you have are already controlled by your doctor and that they are seeing you primarily. We just want to be collaborative, like part of the team.
Yep.
We're not taking over anyone's care. We're not doing any medication management, like titrating your, Zoloft or changing your labetalol. We don't do that. We do just ketamine. We specialize in only that medicine.
Got it. And what did you want our listeners to know today? What did you want to focus on?
Well, you mentioned about the treatments, and I get a lot of questions about why do I need to do it the way that you say you do, where it is the 6 sessions, and then if you need boosters, we do it after that. And I've been getting that question quite a bit recently, like, can't I do just one, see what it's like? Why do I need to do 6? And a lot of times I think it's because of the fact that people have to come into the clinic for that.
Okay.
And the reason I've been giving lately is, and I don't know if I mentioned this last time, but what we want to do is to really activate that neuroplastic benefit over and over and over. So the brain does not grow nearly as fast as, say, if you cut your skin. Neurons don't quite have that same ability to grow so fast, which is why sometimes it takes a while to learn something new. And that's why this medicine comes in, but we have to hit things pretty hard to get that neuronal, we call dendritic spindleization. So if you imagine kind of like roots of a tree growing into the ground, it's the same thing happening in the brain, where those neurons that in this case are relate to mood in the mood centers of the brain, those neurons connecting and becoming more efficient. So they have to kind of slowly grow with the boosting each time in each session of ketamine. So what we want to do is to regrow those connections between neurons to wake up those areas And the research that has been out there for about the past decade now shows that about 6 sessions has some good, we call durability. And that's why we really want to stick to that number of 6 for mood.
Got it. 6. All right. But, someone might say, well, I need more anymore, but I guess that's at their discretion, at your discretion, right?
Yeah, and that's why it's so important to have this be in trained hands of exactly what is good and what is not. I mean, this is a medicine like anything else. And so we do our best with changing dosage, sometimes changing the timing. Some clinics do 3 times a week, some clinics do twice a week. We do the twice a week model. However, we'll change it here and there. So, for example, if someone is incredibly suicidal,
Uh,
we want to do back-to-back treatments. For example,
mhm.
inpatient wards will often do 2 treatments, like day to day, back to back, to get that
I
anti-suicidal
was going to
effect
say,
that I was
what is
talking
the
about. Yeah.
limit? You can only do one a day or one.
So the peak effect of that NMDA receptor antagonist cascade happening. So there's a lot that happens. So we do the IV ketamine, and what it triggers in the brain is a series of enzymatic reactions, which include, just to throw some out there, BDNF, or brain-derived neurotrophic factor, and then also uses the AMPA receptor, goes down through the mTOR system. And anyway, ultimately that recruits growth in those cells. And that peaks at about 3 days, which is why we want to do it at about every 3 to 4 days so that we can recruit the system, recruit that whole enzymatic cascade in the brain, which basically resets everything so that we can get growth. And it's kind of like a way to put it is if you were to have, say, ruts in a mountain, like if you're skiing down a mountain, your whole life you've been skiing down the same way from the top of the mountain down to the bottom of the ski lift. You've been using the same trail with your thinking, but we have to basically do a fresh snowfall over and over and over so you can find new paths to get to where you want to go. And so, but every time we put that snowfall down, then you can find a new path, fresh snowfall, and then regrow in the new areas. So that's why we do it in that way every 3 to 4 days, because of that peak effect of the growth.
Got it. All right.
Yeah.
Well, for someone I've never experienced it, I've heard, from people like yourself about the benefits and what it does. And clearly, we wouldn't be here if it wasn't working. And for the fact, here you are in Nebraska, and just curious how you decided that this was, obviously it's beneficial to everyone all over. How did you choose Tennessee as the next location?
So I have some business partners that I've been working with, and they live in Nashville. And we worked with our first clinic here in Omaha because that's where I'm based. However,
Hmm.
once they saw what we had built, they were like, this blows everything in Nashville out of the water. They had already toured them and felt that what we did was superior. And so it'd be very competitive in the Nashville market. And we have our new clinic in the Green Hills area, which I got to explore and fell in love with. I mean, it's a wonderful city. It's a wonderful part of the city. And I'm just excited to keep working in the Nashville area because I mean, there's a need there just as much as anywhere else. I mean, depression doesn't choose any particular type of person. It doesn't choose a West Coast or East Coast. It hits hard wherever you are and whoever you are. And so we just really want to be able to offer this in that market.
Beautiful. Well, obviously, you're doing an amazing thing. And when is that going to be set to open? A few months from now? Are we talking next year?
Hopefully mid-December to end of January to
Oh, wow.
January, somewhere in
Okay.
there. So, yeah, I mean, I'm crossing my fingers that we can get things in sooner. So I'll let you know, keep you posted. We have all our websites and social media. So if anyone's interested, definitely give us a follow there, and you'll be very up to date on where we're at.
All right. Thanks so much. And again, if you have any questions, you want to reach out, please go to waybridgeclinics.com. And what else in particular did you want to share with us? I mean, I love hearing the stories of how you're helping people, treat people. And, the goal is to assist them with this and then they're better, right? And maybe they come back for some monitoring or for some more boosters, as you say, right? But to get them feeling better and not depressed, not anxious anymore, and to live a healthier life again.
Oh, yeah, absolutely. And the key thing that I want to focus on is how safe it is. That's a big
Yes.
question we get from other physicians, and they want to make sure that our clinic is doing it in a safe way. I mean, I
Okay.
think that we've talked about the oral stuff in the past, how that's in the at-home treatments, but we want to do it in that really safe way, in a way that is in line with what your doctors are already doing. And so doctors always have the question of, do I need to make any changes to their medication, or is there any reason I cannot send a person? And so some reasons like that you cannot come would be pregnancy, or if your blood pressure is completely out of control, or if you have a large amount of cardiac issues or heart concerns that are unstable. And breastfeeding is not a contraindication. We can certainly do that. There's been a paper written on that, and I can talk to anyone who has that question. And I have treated women who are breastfeeding. And oh, that's one
Oh.
indication I forget all the time is postpartum depression.
Oh,
Ketamine works very well for that. So we cannot treat during pregnancy, but following, yes, we can. So
interesting.
yeah, and we definitely want to do all these things in a safe way. And we will look at your medication list. And so people wonder about, why do I have to fill out so much paperwork when I come see you, Dr. Koenig? I just want my treatment. And I understand how doing a lot of paperwork with us can be concerning, or just, tiring, really, just having to fill out the consents. But the reason is because we want to do it safely and to get your medical records, talk to your doctor, because we want to fit in as a part of your entire healthcare team. We're not a replacement. We just kind of fit in there. And one thing that doctors love about us, by the way, in case your doctor has some questions,
Mhm.
is so doctors, like your primary care docs, say you see family care or family medicine or internal medicine. There's a score called a PHQ-9 for depression. If you're depressed, you likely have a higher PHQ-9 score. However,
Is
if you're
and
not,
that's just like, oh, I got you talk to the doctor, he asks you questions. It's not like a blood test, right? I'm just confused.
oh, sorry, no, it's a questionnaire. It's a questionnaire.
Okay, okay, okay. Thank you.
Yeah, it's a questionnaire about depression symptoms.
Oh,
So when it comes down to that, like insurance companies, reimbursement companies want to see these scores are improving with the medication and treatments that doctors are providing. So there is an incentive for doctors to get reimbursed, and it's called value-based care, in case you want to look this up, value-based care. If doctors are helping you get your PHQ-9 scores down, which is an indicator of depression, your value-based care scores go up, which is good for how it looks for doctors treating their patients. So that's what we can help your doctor with, is to get your PHQ-9 scores down, and we can submit that back to your doctor. They get all the credit if they want for lowering that PHQ-9 by making that referral.
yeah.
So that's kind of one incentive for your doctor, and how they can understand how we fit in. So if your doctor is part of that kind of value-based care system, that's where we not only help you, but help your doctor help you.
Got it. Absolutely. And Mal, where you are in the United States, this is an option, right? Every state offers this. You just got to make sure, obviously, you're going to someone who, I don't even know the proper terminology, but who's board certified, who, because there's people that are doing this, but different ways, and it's not good. So that's why we want people to understand that this is the right way to do it at a reputable
Yeah.
place like yours.
Yeah, and that's okay. So I have heard some concerning stories about people who didn't understand the medicine. And it's a little, I think it's a medicine that needs to be very well understood because it works so differently. There's no other medicine out there that works in this with this mechanism of action with the NMDA receptor. So classically, doctors like myself, I give you Motrin, I don't have to worry about your mental state afterwards, or I don't have to sit you in a room because you take Motrin, you simply feel better. It just kind of works that way. But this has an effect on your state of consciousness, and so there's a completely different way of approaching this class of medications, these psychotropic medications. And there's not many out there. Ketamine is one of the first and it is legal, but there are some out there that are in the pipeline to become legal, where offering a safe set and setting is so key. So the reason I bring that up is because you mentioned that it is available in most states, but make
Okay.
sure that your doctor understands how to support that non-ordinary state of consciousness.
Mm,
So it's kind of like it's the same understanding that if you're having dreams, like if you want to dream, you need to have a comfy bed, the right temperature of room. I mean, it's that kind of it's kind of like, oh, why can't you sleep on an airplane? I don't understand. There's just a
Oh,
awareness,
yes,
you
yes.
know? Yeah, so there's this like, doing this medicine in a setting supportive of that extra healing space where your mind is able to be more aware of itself. It sounds a little weird, and it's many people will come up from ketamine and not be able to put words to the experience because it's this very different kind of mental state. So wherever you go, talk to that provider about what kind of setting, preparation, and support you get during the process. It's
Perfect.
super important so that you don't have a negative outcome where something gets kind of too scary. And that's a great thing about the way I do it with the IV is we have a stop button. If something gets uncomfortable, we have a stop button.
Really.
So yeah, yeah. Yeah, because it's a slow drip through your IV. And so if it gets too intense, if it gets too chaotic, this is the only medicine out there with any psychotropic benefits, like or any psychotropic effects that is out there that has a stop button. Most other things are oral. So it's kind of like once you take a Motrin and it's in your bloodstream, you can't take it out. However, ketamine, with the way we do it, we can stop it because it's an IV drip.
Got it. But you still have some of the effects from what you just
Yes.
got before, right? Okay, okay. I'm like,
Yeah.
wait, I'm trying to figure this
Yeah.
out. Never done it, never, I'm trying to think the only IV experience I have is when you're in the hospital, they put the fluids in me and I'm awake, so you just feel cold. And if I was doing anesthesia for like a nose surgery when I had my nose scraped out 2 years ago, I remember for the first time feeling like it's coming upon me, whatever they gave me. It could be that, or I think
It's
it was
possible. Yeah.
propofol.
Propofol.
Yes,
Yes.
but you just feel like, and then you wake
Yeah.
up feeling amazing. And it's like you feel like you had sleep for like 10 hours and it was only like 20 minutes.
Yeah. 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 Propofol is another amazing medication. And that's another one that I've used in the ER. And that's the thing about knowing your medications, being a physician, is everything has a benefit to it. But we always learn about the risks, benefits, and alternate options. And that comes down to ketamine as well, is knowing the risks, knowing the benefits, being informed, asking your doctor and your doctor talking to you about all of it so that you can go into it very educated and ready for the treatment, which is
Yeah.
incredibly healing when done correctly.
Well, we're excited to get to know you further, and hopefully, people will come visit you in the Nashville location if you're listening from Tennessee. In the meantime, you have obviously Omaha, which has been doing amazing. How many years has it been now?
It's been over a year.
All
Yeah.
right. And what would you find the most challenging when people come in the office? Is there something they're always concerned about, worried about, or what's something that you hear all the time?
Honestly, I hear that people are afraid that it's going to work or not because you do become such a different person, where it's like they're afraid to have hope is a better way to put it. Like, what if I get better? What if I don't?
Yeah,
It's something where there's this thing you're aching for, and then at the end they get it, and then they just want to continue having that benefit. And it's one of those things where the family members, the same question, like, I'm afraid of this not working. I want it to work, but they're afraid to have hope. And it just shows how much people have been disappointed by the
yeah,
system, and we're offering something so new and different that has all these promises. And I do let people know I can only promise to do the best I can. I can't promise the medicine is going to work as well as it did for this testimonial, this other patient over here. Um, because the medicine meeting your brain is very individual. However, I can promise that we'll do everything we can to get the ketamine to work, and
yeah,
that it's okay to have a little bit of hope. And there are
yeah.
things coming down the pipeline that are other options. And we approach it with such an integrative standpoint that I'll often bring up, holistic practices that people never considered.
Got it.
So, advising, would acupuncture be helpful? Can we start doing a new exercise regimen? Are you ready for trying just an adaptogen? A lot of people don't know about adaptogens, and I can speak to that being an integrative fellow. So,
Beautiful.
yeah,
And just curious, right now, a lot of insurance isn't covering this. Is that true? It's mostly out of pocket. Is it
that is
affordable?
true. That is true. Well, and when you compare to a lifelong,
Of
what do you lose when you're
hmm
depressed? How many days sick? How much time where you're just lying in bed and you don't have the motivation to do something?
Yeah,
If you're at work, is your productivity dropping? and
Okay.
how much is that costing you in getting promotions. So there's all these unseen costs of depression that when you compare it to
You're
what
gonna
we
factor
charge,
into,
it's
yep.
it's pennies. Yeah, you'll get back a huge amount of your investment in yourself.
But do you think one day the insurances will start accepting it because they're gonna realize that it's important? Like, how does I don't know how it works in the healthcare system, but is it possible it will be covered one day?
We're working on that.
Okay.
There are some employer benefit insurance companies that I have been speaking with who are already trying to make this, and starting with ketamine, the path forward in treating mental health in the future. Just the way that the system has been set up, where everything has to be FDA approved at the outset with every
Okay.
indication. This happened to be one where we found a benefit after FDA approval, and so it's considered off-label. They don't go back and FDA approve it again. But that's the loophole
Okay.
that the insurance companies get out of. Despite showing all the benefit, you can show them all the research and all of the data, and it doesn't matter. They'll still bank on, well, it's not FDA approved for this, but the FDA won't go back and reapprove it. They just say you can use it off-label. We use many things off-label.
Got it.
I do it all the time in the emergency room. There's so many antibiotics used for a different indication than what they were FDA approved for, and no one blinks an eye. But in this case, it's just it fits in this unfortunate model that they can deny it, and by the book that they wrote, they won't have to pay. But that it doesn't mean that that's in your best interest, which is unfortunate. I don't think
Yeah.
insurance companies are really there to serve patients as much as um,
Mm-hmm.
another purpose.
Got it. Well, let me also ask about, I haven't spoken, well, you were away last week, but like any new client experiences that you wanted to share that someone is really loving the benefits of this and, or anyone they worked with in the past that really can attest to,
Yeah.
wow, this is
Oh yeah.
amazing. This is so helpful.
Oh gosh. Well, yeah, we actually recently got a new Google review. We have all 5-star reviews, so you're free
Ah,
to Google our business, read our Google reviews, and that's just a written account.
wow.
We did put them up. I mean, I recently did presented to a clinic of doctors, and I showed them one of our because they're doctors. I was like, well, you listen to doctors besides me, and so I gave them a testimonial of one of the physicians we treated, and I showed them her testimonial, which is on YouTube. You just have to go on YouTube and search Waybridge clinics, and you'll see all our patient testimonials. And what they talk about is getting the joy back in their lives, having that sense of gratitude, having that lifting of pain, lifting of depression, and being able to reestablish relationships, finding a joy in life again, just feeling deeply that, they can trust us is another one that I was surprised to hear with our testimonials. How much, I mean, I'm always thankful that I get some credit, I guess. Not
Hmm.
why I do it, but they're, I think what it speaks to is that what I offer is so different
Yeah.
that patients are thankful that this is an option and I'm being a voice for it now. I think that's a big testimonial that we get is thank you for even offering this
Yeah.
and knowing how to do it.
Of course, the right way, the safe way. And yeah, and there's
Yeah.
a lot to be said for that because there's some underground people dealing, you hear the word ketamine, you think drug on the street, which people do. And that's not the same type of treatment we're talking about here in a clinic like Waybridge. Uh-uh.
Oh no, no. I mean, it's simply that there is a need for mental health to be served in a better way. And ketamine does that. And I don't want people to be so desperate they're going to the streets because that's not the right thing either. We're a safe and effective and proven way to get your mood to be better. And it's far better than many other drugs out there. I know so many people who reach for alcohol to feel better. They reach for their pain pills to feel better. They reach for their, Ativan and Xanax. And some of these are, pain pills are prescribed, benzos are prescribed, and yet there's still a better option in ketamine. And I would really ask people to ask their doctor about maybe doing a less addictive option, one that has less tolerance and has longer benefits, more than just when you take the pill, it's a one
Yep.
and done. It's not a solution, but ketamine
Mm-hmm.
can be for some people.
All right. Well, we still got 2 more minutes left here. Not cutting you short, never will. What else did you want to make sure we talk about or get to before we have to go?
Um, I guess if you're interested in following us, I'm on Instagram. I mean, I post on there quite frequently. We do have those new testimonials on our Google website. We are going to be revamping our website. So if you want to follow on there, we'll have those video testimonials up there. We are still working with the VA. So if you have any veterans in mind, we didn't get into PTSD that much this time. However, Veterans Day is coming up. And if you have a veteran in your life who goes to the VA, have them give us a call because we can get referrals through the VA. So that's just, and I'm just trying to get more in touch with other networks of like, nonprofits for mental health, suicide, anti-suicide measures, where we can hopefully work with getting grants and getting anyone with financial difficulties having it covered by one of these organizations. So I'm really trying to get in touch with those kinds. So if you know of anybody who might be interested,
Reach out. Yeah.
please get connected. I'm all about spreading the word and connecting with other nonprofits and other philanthropy charities that are trying to help people with mental health issues.
Beautiful. Thank you so much. And how should we contact you? Not how, if you can, you should. Go ahead, tell us. And by the way, for Nebraska, so I'm assuming you have to be a resident of Nebraska to go to your clinic in that sense. No, can some out of state come to you or no?
Oh yeah. Oh yeah. I have
Oh,
many
okay.
people from out of state come in.
Oh,
Yeah.
awesome, awesome, awesome. All right, good to know. And the website one more time is Waybridge Clinic.
Waybridgeclinics.com.
All right. Thank you so much. Always a pleasure seeing you. And again, love the thunder lightning look on the shoulder there. It looks beautiful. And Northern Lights, it's kind of mixed together. As my son would say, he's so devastated because a few weeks ago we saw the Northern Lights here in New York, but we were away for a wedding in Turks and Caicos. So anytime I see that like purpley color together, I
Oh
think
yeah.
my poor son. So now I got to take him to Finland or somewhere far, Norway to go look at these. One day, we'll see.
That'll
Hopefully
be
they'll come
great
back
too.
soon. All right. Thanks again for being here, for joining us, and have a fantastic day. We'll talk
Thank
next week.
you.
Thank
Bye.
you. Bye bye.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com, or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, I mean, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
mortgage-free, fully adaptive, handicap-accessible house.
And there's no catch.
It'll be our very first home that we've ever owned. This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.